I'm excited to introduce our community today to Dr. Kenneth Zweig, an internist at Northern Virginia Family Practice Associates, a family medicine practice providing full service concierge health care in Northern Virginia area. Welcome, Dr. Zweig.
Thank you, Lindsay. Thank you for having me.
So excited to have you. Can't wait to pick your brain today. But before we do, just kind of give us an idea of where you started out and where medicine has brought you today.
Okay. I'm originally from Pittsburgh, Pennsylvania, and went to school at the University of Michigan for undergrad and Ohio State for medical school, which is a hard dichotomy there, but both great
I'm from
schools.
Columbus, Ohio.
You're from
That's where I was
Columbus.
born and raised.
Is that right? Okay, great. Columbus is a cool town. And it's really changed. It's really come into its own. So yeah, it's a
Right.
neat
Yeah,
place.
go Bucks.
Yeah, no, yeah, I'm sort of a maize and blue guy first and foremost, but Big Ten number two, so that's okay.
Right. Okay.
And then I went to Georgetown for my residency. And so I've stayed here in the DC area ever since then. And I've always had an interest in primary care and preventative medicine. I think that something that we don't do nearly well enough in this country is prevention. And there's so much to it, and it's complicated and can be hard, but it also can save so many people money and time and troubles and pain and suffering. There's so much that goes on in this country that doesn't have to happen. I'd say about 80 to 90% of what I see are things that could have been prevented either by the patient doing something better themselves, the doctor doing something to help them better, society doing something to help support them better. But there's always something that you can do preventatively. And so I've really taken an interest in that, in trying to keep people as healthy as I can.
Does that ever become a huge frustration for you, to your point of we're trying to play some catch up here in this country of doing more of the preventative care? Where are some of your big blocks that you come against where you go, why does this have to be so hard?
Yeah. Well, my big frustration is at a societal level, the way our system is set up, we really focus on treating the problem after it's occurred. We really, as in most industries in medicine, you follow the money, and the money doesn't go to primary care. It goes to electron beam, treatments and, big surgeries and things like that. And so we wait until people are sick and already past the point where prevention is no longer an issue. And that's where we put all our effort, is to pull people back from the brink, where I think we should start from the beginning and prevent these things from happening in the first place. And so that's my frustration, is that the way that insurances are set up and big hospital systems are set up and Medicare and all these things are designed to focus on people after a problem has occurred, whereas I'd like to see us focus much more on preventing the problem in the first place. So that's my frustration. On an individual level, when I'm seeing patients, I love it. I love seeing them and discussing prevention and preventative care and looking at the challenge of how can I get them to do what they know they already should do. So I love that part.
And my guess is, and you can go into describing this too, but since you're concierge, like you get time with your patients, right? What does that session look like?
Right. Yeah. So yeah, in my previous practice, for years, I actually was able to do it. And then, like it's happening all over the country, my old practice got taken over by a big hospital system, and I no longer had the time to spend with my patients and give them the care that I really wanted to give them. And so now that I'm in this new practice, I definitely have the time to spend with my patients, discuss what their blocks are, talk about how we can get them doing what they need to do, and what can I do to help them. And so I've really been able to support my patients and show a lot more success. And really, when you're able to take the time and you're not rushing through all your patients, yeah, you can really make a much bigger impact. It's on a smaller number of people, but the impact is far greater. And so it really feels good as a physician to be able to practice the way I would like to and the way I know most physicians should practice.
Right. I had a client just walk out of a session similar to yours the other day and go, oh my goodness, I sat there for an hour with this physician and they actually answered all my questions. Yeah. And it was like mind blowing, right?
Yeah.
Felt so taken care of and calm. It was just like a wonderful, wonderful experience. So I love that you're out there doing that. You and I have something big in common that we really like to hone in, hit this whole behavioral change area. And I'm sure you see this a lot with your clients. Tell us give us some case studies, maybe like a sleep example or a hypertension example where you get to really bring in the behavioral change talk with that.
It's what I do 95% of the time. I mean, an example is every day. I always tell my patients that medicine's not hard. It really comes down to four things. After 20 years of practicing in medicine and 8 years of training, I figured there's only four things that you can do in medicine. It's eat right, exercise, get enough sleep, and don't be stupid. Don't drink too much, don't smoke, don't do drugs, be reasonable about what you're doing. So it's just those four things. And it sounds crazily simple, but it really is. The hard part is doing those things. It's really hard to get yourself to do those things. And so that's where I spend most of my day, hypertension, diabetes, obesity, arthritis, high cholesterol, most of what I see really comes down to behavior. And if everybody did what they were supposed to do, I'd probably be out of a job. Unfortunately, I've got job security. I don't think that's going to happen anytime soon. So it's a huge part of what I do. Examples, the big place where I feel really good about behavior change is in alcohol use, because one, it used to be smoking, but we don't have very many smokers anymore, which is great. And so now, but with COVID especially, people have gone to drinking a lot more alcohol, and there's just a lot of alcohol use right now. And so that's a hard conversation to have. A lot of people don't want to hear it. They don't want me to talk to them about it. But when it's really impacting their lives and I'm able to sit down and talk to them and go through the methods and ways of getting them to cut down or even stop alcohol, I have the time to talk to them. And when it works and they come back to me and they say, "Doc, I feel so much better. Thank you so much. I'm sleeping. My mood is better. I've lost 10 pounds. I really appreciate that." It feels great. And that's one of the places where I feel like I've shown the most impact, because it's so obvious. With high blood pressure, their blood pressure drops 5 points or 10 points because they did something. That's great, but they don't feel any different because you don't feel high blood pressure. But, with alcohol use, when you get somebody to make that change, they come back and they tell me how much better they feel. And it's such an obvious change. And that is what gets me up in the morning and gets me going to work.
Right. And what's interesting about the alcohol topic is that if you were still only given that 10 to 15 minutes to pop in and out of a room, you probably wouldn't have approached it, I'm guessing, because it just takes too long to sit and explain it.
It is. It takes a long time. And it takes a long time. Part of the hard part is not just explaining how to stop. It's just convincing them that it's something that they should do. A lot of alcoholics are so used to it that even though they're not sleeping well and they're depressed and they have high blood pressure and they're overweight and all the other things that alcohol can impact, they don't see that direct correlation. And so it can be really hard to impact them. And they say, "Well, I've got a stressful life and this really helps." It doesn't. And so it takes some convincing to get people to realize the impact of alcohol and why they're having all these problems, that it's directly related to it. And so it takes some time. So it is hard to get people to convince them. The first step is just recognizing that there's a problem. Yeah. And so if you can't get somebody that there's a problem in the first place, you're never going to get them to change anything.
Do you feel like you do a lot of training the brain to recognize when the reprieve from whatever is coming? Again, like you're saying, alcohol, you get some pretty instant weight loss, better sleep, that. But even with those other conditions, even hypertension, are there things that come along with that where you're training somebody to go, "Hey, if you feel this way, that means that we're making some progress"?
Sure. I mean, your body tells you how it's doing. Your body keeps the score, right? It tells you if things are going wrong. You most of the time, I mean, it is not 100%, but most of the time, when you feel crappy, it's because you're not treating your body right. And then when you treat your body right, you feel better. And the hard part is it's not an immediate effect. So, when you eat a salad, you don't all of a sudden, "Hey, I feel great." People don't say that. But if you do it over long periods, you're going to have more energy. You're going to look better. You're going to feel better. You treat your body right, it treats you right. There's a definitely give and take. And so, when people come back after they've made the right changes, they can tell me, "I feel better." And you can, I would say, high blood pressure, cholesterol, blood sugar, weight, all those things, those aren't the problem. They're the result of the problem, right? You're not going to change your diet so that you can bring your, your goal is not, I'm going to make my blood pressure 5 points lower, right? That's not what you're thinking when you get up in the morning. Your goal is, I'm going to eat right and I'm going to exercise today, whatever and however that looks. The weight, the blood pressure, blood sugar, the cholesterol, that's just the result. Those are just markers for how you're doing. When you're not doing the right things, all those things go up. When you start doing the right things, all those things get better. And so those are really just ways of measuring how you're doing with the simple processes.
Right. And I'm so thankful of those ways of measuring, because I don't know how much you know about me, but I get really frustrated with the scale with my clients to the point where I've almost thrown it out the window. And then I'm like, no, I see a spot for it. But it's just so frustrating because I think a lot of times, again, in shorter doctor's visits, there's the come in and weigh in, and then we talk and then you leave, versus being able to really pinpoint all those other markers that are the success factors.
Yeah.
So,
I like weight from the standpoint, because I always call it it's the poor man's cholesterol check. It's a good way of keeping track of all these things, because, it's going to fluctuate some. It depends on what time of day and what you're wearing and when you last ate and all these other factors, but it can give you a rough idea overall of how you're doing. And so, if the weight's going down, the blood pressure is probably getting better. Cholesterol is probably getting better. So it can give you a good idea of how you're doing. And I say, if your weight goes up, you say, and you're checking it, say, I shouldn't have had that pie last night. I got to do a little bit better. And if the weight goes down, say, hey, I'm doing okay. Pat yourself on the back, and I'm doing the right thing. Let me keep doing that.
Yes, no, I hear you, but sometimes I feel like it's not that direct of a correlation. And then the mind games begin. And it's like, well, I was eating well. And why did that just bump up? And is it sodium? Is it water weight? Like blah, blah, blah.
Yeah, you're right. Not to check it too often.
Can I pick your brain while you're on here about, do you see a lot of clients with restless leg syndrome?
I do see them. I don't say I see a lot, but I do definitely see them. Yeah.
I just feel like that's been kind of a topic amongst our community, and that not a lot of really great answers to it. Like, what are some of your main things that you head towards when a patient's struggling with that?
Yeah, well, it depends what you mean by struggling with it. I mean, is it keeping them up at night? Is that what you're saying?
Yeah,
there's something called periodic limb movement disorder, where it keeps up their partner. It doesn't affect their sleep because they're kicking them in the middle of the night. But If it's waking them up, there's a number of things that we look at for that. So, anemia is something that can cause it. Diabetes is something that can cause it. So you want to make sure that you're screening for those two things. A lot of people are on antidepressants now, especially with COVID and all that. There's just been such a rash of mental disorders recently. And so we put people on these SSRIs or SNRIs, these antidepressants, and they don't realize the effects they can have, and that those can be a very common cause of restless legs. And I think a lot of doctors probably don't even realize the connection between that. And then, some other things, over exercising or pushing too much can do it. And so I always tell people there's some simple things they can do, doing anything that's good for your muscles. So if you can give yourself a self massage or one of those rolling pins to massage out your muscles before bed, to take a hot bath before bed can really help. Untucking your sheets, believe it or not, actually having your sheets tucked in can worsen restless legs. So that's a struggle that my wife and I work on, because she likes them tucked and I can't stand it.
Tuck.
Yeah, right. So those are some things that you can do. And then there are medications. If you get to the point where those things don't work, there are medications that can help as well. For really just about everybody, I have one patient who is not controlled very well, even with all the medications that we have, and I just can't get his condition under control. And so I had to refer him out. But he's the only one. Everybody else, if they've gotten to a point with even trying those other things and ruled out all the bad causes, I still, with medication, everybody is pretty much able to get under control. It's rare that we're not able to manage that. So all they have to do is see the physician, talk about it, and make sure you rule out any underlying causes for it.
Oh, interesting. Do you ever see water as a correlation with it exacerbating or not?
Exacerbating restless legs? Mean too much or too little?
Too little of water causing that night to be more severe?
I've never seen that. I've never seen that written as a possibility.
Let's talk sleep for a second, since I feel like this is like that big, it affects everything. And yet I feel that little of importance is held on it. What are some of your hardcore recommendations around sleep?
Yeah, so this is my baby. Sleep is just like the most important thing that we don't talk about. And in my mind, and I think there's lots of good evidence to support this, is that sleep is the absolute crucial foundation to good health. Without good sleep, it's hard to exercise. It's hard to eat right. You lose your inhibitions. You drink too much. You do other things that you shouldn't do. It just, without good sleep, everything else falls apart. And so sleep is just the absolute crucial, non-negotiable foundation for good health. And a lot of people say, I'll sleep when I'm dead, or I don't need a lot of sleep. I only need 6 hours. Oh, well, yeah, actually, you got diabetes and high blood pressure, and you're overweight. Yeah, you do need more sleep. You may feel like you don't, but you do. So some of my main recommendations are that virtually everybody, and there's really no outliers to this. I mean, maybe 0.001%. But if you think you're not somebody who needs enough sleep, you're probably almost certainly wrong. That everybody needs at least 7 hours. 7 hours is just the absolute solid cutoff. And that less than 7 has clearly shown repeatedly that you have a significantly increased risk of virtually everything. You have an increased risk of heart attacks, of strokes, of high blood pressure, diabetes, depression, anxiety, obesity, cancer. You make less money, you have, less enjoyment in life. I mean, you name something that you want to get more of out of life, unless it's cable TV, there's nothing that is going to help you get that more than a good night of sleep. It really is just crucial to everything that you want in life and how you feel. And for people who say, I feel fine on less sleep, I don't need that much sleep, what I'd say is that people have different thresholds for pain, and some people can break their leg and continue running a marathon, and other people get a hangnail and they can't go to work for 3 days. We have different thresholds for pain. We also have different thresholds for sleep. And that people who say, I'm not sleepy, I don't need that much sleep, actually, when they look at those people and they do studies of reaction times, memories, and time to falling asleep, and other factors that we look at for people who are actually chronically fatigued, they are actually much sleepier than they think. They just don't perceive it as sleepiness. So absolutely 7 hours. And it's usually 7 to 9. So 7 hours is not enough. If you're still tired after 7 hours, 50% of people need 8 or more. So you want to really make sure that you're getting enough sleep, and should wake up feeling refreshed and feeling like you can get through your day without needing a nap or falling asleep. So that's the big thing, is make sleep a priority. And make it a routine too. So you don't want to get to sleep at 10 o'clock and get up at 6 on a weekday, and then go to bed at 2 and get up at 10 on a weekend, because that's going to make you feel tired too. You want to be pretty consistent about sleep as well. It's really an important thing.
If you had that first bit of low-hanging fruit, a tip on doing sleep, what would you attack first? Just really picking a bedtime more so than the waking up at the same time, or?
Yes, absolutely. A lot of people have a set wake time. Few people sleep through their alarms, right? You can sleep through your alarm, but you're going to get up not too long after it. And a lot of people tell me they get up 5 minutes before their alarm every morning. We have a set wake time. We also have a set sleep time, and you get a little sleepy around 8:30. A lot of people tell me that, they're falling asleep around that time, but they're like, it's too early, I don't want to go to bed. Well, that's what time your body wants you to go to bed. That is your circadian rhythm telling you that it's time to go to bed. And if you don't, then it says, okay, well, I guess there's something important to do. Let's rev up and get you going again. And so you get a big surge of bad hormones like adrenaline and cortisol and things that keep you up for another few hours, but that also makes your blood pressure and blood sugar and other things go up. So you don't want to push through those too much. So I always say to people, we have an alarm that gets us up in the morning. Set an alarm to go to bed. You should have a set sleep time, and set your alarm to say, hey, it's time to go to bed. And if you're always watching TV, or you're on the computer, or whatever it is, you're doing some electronic, because we all are at night, let's face it. If you can set that on a timer as well, that's going to help nudge you into that direction. So, if everything else, and you're watching TV and you're like, I'll watch one more, and then the TV turns off, well, you have to either make an effort to go back and turn it back on, or you say, okay, it's time. I'm going to go upstairs and go to bed. And so setting an alarm to go to sleep, I think, is a really helpful thing.
Yeah, I like that a lot. I've heard like make it a date with your bedtime or just, schedule it, but having something really auditory show up and say, it is time, shut down.
Yeah.
Let's talk about the ways that people mute those signals of tiredness.
So yeah, so again, this is what keeps me in business. So the more tired you get, and this is with everybody, all of us, the more tired we are, the dumber we are, right? We all do stupid things when we're tired. And so the later it gets at night, the harder it is to do what you should do. And so, if you're sitting there watching TV and it's time to go to bed, you got to get up, you got to go brush your teeth, you got to change your clothes, there's things that take an effort. It's a lot easier. The low hanging fruit is just to sit there and keep watching TV, right? And that's the easier thing to do. Plus, a lot of people also tend to, think that they've had a rough day and they deserve another show or they deserve a drink. They need something to de-stress, to unwind, something to give themselves. Well, I always tell people that signal that you've had a stressful day, that you are deserve something, that's a misperception. And really, that signal is probably the signal that you need more sleep. The thing that you need for yourself is not another TV show. It's not, reading, something on the internet or another drink. The way to de-stress is to go to sleep. May not be as much fun, but it's the thing that's going to make you feel better and get rid of stress. Stress is a perception. It's a perceived reaction to real stressors. And my patients, like everybody, have real stressors, but your reaction to those stressors is your stress level, and that's subjective. The less sleep you get, the more stress you feel. And so when you're feeling like you need a de-stressor like a drink or another TV show, what you really need is more sleep, most likely. And so that should take priority. But that's what a lot of people do, is they're trying to abate their feelings of stress or eat away their stress or drink away their stress. And really it's a misperception that it's actually sleep is what you need. And so I try to explain that to them, that they're sort of crossing their signals a little bit.
Right. And then it becomes this cycle because you're not really addressing the true issue. Then that extra drink makes you even more the next night feel like you need it or yeah. Why do we all revert to like this little kid mentality of don't put me to bed? Like I feel like
oh my God,
it's so hard.
It's so funny. I never realized this in medical school. They always say in pediatrics that kids are not just little adults. You want to treat them differently than adults. They're not just small adults. Well, and I always took that to heart. But then I became a parent and I realized that, kids are not small adults, but adults are really just big kids. We all do the things. We have our tantrums. They just look differently. We don't want to go to bed, but we don't have, nobody's putting us to bed, so we can stay up. We really are just big kids. It's really funny. It's the same things. It's just they look different than they are in children, but we just never grow up. And so it is a funny thing. Our brains can be our biggest enemy sometimes.
Absolutely.
And, I don't know why. It's just, people say it's not fun to go to sleep. We feel like we want to have fun, but and there's all this societal pressure too. Like I said, people say you can sleep when you're dead. Well, unfortunately, it's going to come a lot faster if you take that mentality. And so, you have to just really make it a priority. A lot of people have fears around sleep because when you're reading or watching TV or doing something, you're not thinking about work. You're not thinking about things that are going on in life. When you're sitting in a quiet room with the lights out and all you have is you and your brain, that can be a tough combination because then you start ruminating on all the stressors. And so a lot of people also have fears around going to sleep and don't want to until they're really, really, until they can no longer stay up.
Right. So true. Yeah, that's interesting. Man, there's always little onion layers, aren't there, that you got to peel back to see what's really going on. Yeah. And you do that. What am I not asking about your practice that would be really helpful to shout out?
Well, I guess people have a very negative connotation of what concierge medicine is a lot of times, and including me, a lot of people in the profession also. And so they think that it's just people going for the money or just the easy life. And I really struggled with the decision to go to a concierge practice. And so I really took a big part of me to decide to take this practice. If it wasn't for the practice president really pushing me and showing me what it was like, I probably wouldn't have accepted it. I never would have considered it even. What I would say is that, the idea of, doing it for money or doing it for lifestyle, that doesn't apply. That really the best thing about it is, for me and for everybody in my practice, is we do it for the medicine. That we, as we talked about before, we have time. We do it because we get to practice medicine the way we want to practice. It's the best kind of medicine. It's unfortunate that we have to do it to a small and more elite group. And that is a struggle for me. And I don't like leaving people out. And we always talk about how we can give back to the community in a lot of ways. But really the motivation is to practice medicine in the best way possible, because so many doctors are out there right now that when they're on a time crunch and they're limited to how much time they can see with people, they're not practicing medicine. They're just surviving. They're just getting through that visit each time as quickly as possible and just doing whatever it is that they can get through and move on to the next person. What we do is talk to the patients, listen to the patients, address everything, and really practice the way we were taught and the way we want to practice, which is really in-depth, medicine, where you get to know your patients and treat them on the most basic level and treat the whole person. And that's what really makes me happy now. And, like I said, gets me up and gets me going to work.
Well said. Yes. I feel like a lot of professions do deal with this. I feel like physicians more so, but just the whole idea of being so time limited. And I guarantee people go into medical professions, and I see this with physical therapists as well. And even dietitians can fight this, but we go in because we care about the other person. Like we're not true business mindsets, like there is some passion and love for the person. And so anytime, I guess I'm just saying this to our listeners so they can hear that loud and clear, that if you have that perception that it's so money driven, the reality is that person is a medical professional. Like they do care about you. I love that time. And again, I feel like I've seen that with physical therapists. I've seen it with even chiropractic care, and going just fee-based versus anything insurance-based, so they don't have to stick to one diagnostic. We're seeing it more and more. And
it's unfortunate. So many practices have been taken over by big insurance companies or hospital systems. And with that, the primary care, which is, the foundation of medicine, in my mind, certainly, gets hit the worst because it's not where the most money is made. In fact, it's the least money maker, but they refer to the places where the money is. And so it's a necessary evil in the CEO's mind.
Yeah.
But if you had good primary care where you can take care of the people and you can spend time with them, you don't need all these other things, right? If I have time with my patient, I don't need to send them to a cardiologist for the high blood pressure. I don't need to send them to an endocrinologist for their diabetes. I can take care of the vast majority of things if I have time. And so a good primary care eliminates the need for all these other procedures and specialists and things. But that's not the way we look. And by eliminating that need, we eliminate a lot of the money making. And so it's just not a focus. It's an unfortunate reality of our current system. But if we put more focus and more effort on getting people into primary care and give the primary care doctors more time, I think we could make our system infinitely better.
Agreed. Speak on just be your own advocate for a minute. Like if you are sending listeners out going, these are maybe the top couple questions you should be asking as you enter into an appointment to know that you have a good fit going on. What would that look like?
Good. Yeah. Well, I thank you for asking that. That's a great question. In my old practice, I wrote an article on how to prepare for your visit. And so being prepared, just coming to the doctor cold, you're not going to get out what you want. You get out what you put in. And so if you're prepared when you go into a doctor's visit, I think you're going to be a lot better off. So write down the questions that you want to know. Do your own research, beforehand. If you have a condition or think you have a condition, everyone always comes in saying, the doctors hate it when I look things up. No, I love it. I want you to be educated. I want you to know, as long as you look it up at a respectable place, don't go to some random website or what you heard from your uncle on Facebook. But if you go to a reasonable website and did your own research and you know what you're talking about, I love it. That means that I'm going to have a better conversation with you, and I can, reinforce or dispel any misinformation that might be there, or maybe I'll learn something. I don't know everything, and we can look it up together. But be prepared, bring your questions, do your research beforehand, and don't be afraid to ask. The other thing I always tell people, which is a non-intuitive but important thing, is wear the appropriate clothes. I get people who come in with knee pain and they're wearing tight jeans. I can't do a good knee exam if you're wearing tight jeans. You got to take them off. Or if you have a rash and you're wearing a one-piece thing, it's hard to get to that. So just keep in mind what you're coming in for and wear something that's going to make it easy to access that part. So.
Seems simple, but I can totally see people not doing it.
Right?
Yes.
Exactly. Don't think about it.
I got to see it. Oh, that's good. Yes. I hate to say this, but we are kind of wrapping up. Best places to find you, as well as like that final tip that you just hope people heard out of you today.
Okay. Well, yeah. So we have our website at nvafamilypractice.com. I also do a blog called Ounce of Prevention MD, which you can find on that website, or you can find it actually on LinkedIn as well. If you just look up Ken Zweig MD on LinkedIn, you can find my blog. And then also the best thing I think you can take away from this is get your sleep. Sleep is absolutely crucial. And it's the one thing in medicine where if you take care of that action, you will feel better. Everything in your life will likely improve if you're not getting enough sleep now. So take care of your sleep, make it a priority.
You hear that, listeners? Sleep. Oh my gosh. Okay.
Yep.
Thank you. That was awesome. Thank you so much for joining us and giving us your expertise today. We really appreciate it.
My pleasure. This was fun. Thank you, Lindsay.